So I want to talk to you today about external cephalic version. You are 36 weeks pregnant, and despite your best efforts and all of the different techniques you've tried, the baby is continuing to stay in a breech position. So at this point, external cephalic version is another option for you to try. What this is a trained provider will use their hands on top of your belly to physically move the baby into a head down position. This is usually done between 35 and 37 weeks of pregnancy because the baby is probably small enough to move and also large enough to stay head down once they're repositioned. The success rate for this procedure is about 50%. The other half of the time, the baby either won't move during the procedure, at which point we do stop because we don't want to force anything, or the baby is able to be moved into a head down position, but then reverts back to that breech positioning. You are a good candidate for this procedure because you've had a healthy pregnancy up to this point and your baby seems to be growing normally, and you also seem to have an average amount of amniotic fluid. Some things that would risk you out of doing this procedure would be if you had too much or too little amniotic fluid, if the placenta was toward the front of your uterus, or if you were in labor, your water had ruptured. We would not be able to do this procedure. So if you choose to do this, then the first thing that we will do in the morning beforehand would be to send you for an in-depth ultrasound called a biophysical profile, which looks at the baby's well-being. They check heart rate, amniotic fluid level. We'll also have them check the position of the placenta. And I do this because I want to make sure that it's likely your baby will tolerate this, all this movement and maneuvering. So after the biophysical profile ultrasound, you'd come home. I'd want you to take a nice warm bath with Epsom salts to help you relax, help all your muscles relax. And after that, you'd empty your bladder and then find a comfortable place to lay down with your hips elevated. So I'd want you to have a pillow or a cushion underneath your hips as you're lying down to encourage the baby to move out of the pelvis, making the version easier. And you're gonna lay there for about 20 minutes or so, 20 minutes to 30 minutes. And during that time, my assistant and I will arrive at your house. I will confirm that the baby is indeed still breech and that they have moved up and out of your pelvis, so that we can do the version. And my assistant will listen to heart tones for about 2 minutes to get a baseline and then continue listening throughout the procedure every 1 or 2 minutes. Afterward, if the version is successful, I'll have you be upright for an hour or more. You can stand, walk. Some people do the stairs, maybe you do lunges or squatting. And this is to encourage the baby's head to really engage in the pelvis so that it's less likely that they will flip back to breech. And during that time, we'll continue monitoring heart tones about every 20 minutes or so. There are risks associated with this procedure. One of those risks is rupturing the bag of waters, and at this point in pregnancy, I would recommend transferring to the hospital for an induction because of the increased risk of infection prior to 37 weeks of pregnancy. Another risk is placental abruption, and that's when the placenta separates from the uterine wall. And this would lead to bleeding or even hemorrhage for you, and also cuts off the oxygen supply for the baby. Another risk is cord entanglement or cord compression. And again, that decreases the amount of oxygen that's available to the baby. And we would hear this reflected in a drop in their heart tones, which is why we continue to listen to the baby throughout the whole procedure. Now, because of these risks, the standard of care is to have this procedure done in the hospital, because then you would already be there if something were to happen, and they would be prepared to manage whatever complication it was. I do offer it out of hospital because the actual risk of any of these complications happening is less than 1% of all, or less than 1%. But I just want you just need to be aware that the standard isn't indeed in the hospital so that you can make the most informed choice that, for you and your family. If the version is not successful, then the next step would be to either find a breech-friendly provider who is willing to assist you with a vaginal breech delivery, or to schedule a cesarean delivery. And I'm more than happy to support you in either of those decisions. So I know that's a lot of information. What questions do you have?